Hi, I'm Bill, the knee pain guru. Today we're going to talk about torn ligaments in the knee. And I've gotten questions recently about the different types of torn ligaments. And there are four. There's the ACL, the MCL, the PCL, and the LCL. The ACL is the anterior cruciate ligament. The MCL is the medial collateral ligament. The PCL is the posterior cruciate ligament, and the LCL is the lateral collateral ligament. The most common type of ligament injury is the ACL, the anterior cruciate ligament. That is the one that I tore, and most of the clients that I work with or people that I've worked with have had ACL injuries. And that's common sports injury, basketball, football, soccer, right across the board. However, what happens is ligaments can be partially torn or completely torn. And this is really key if you're going to your doctor and your doctor says your ligament is torn. It makes a huge difference if the ligament is partially torn or completely torn. Because if it's partially torn, we can look at setting up the right conditions so your body can heal itself. Your body can actually heal a ligament. It does take a long time, but it can do so. Like when I tore my ACL, I partially tore it 3 times before I actually completely tore through it. So if my learning curve would have been a little steeper, I would have laid off of that and allowed my body time to recover, changed my diet around, changed my exercise routine around, and not put so much pressure on my knee to perform, and I believe my ligament could have healed itself. However, I didn't. I completely tore through the ligament, and in that case, when the ligament is completely torn, that's when I ended up having reconstructive surgery on the ACL in my knee. So it's very important to understand what you have going on, especially when you have an injury, especially when you have a ligament tear, as to what you're dealing with. When you understand what you're dealing with, you can make better educated choices for your knees as well as the rest of your body.